So we've been here for a couple of days in Las Vegas, and I think it's an interesting perspective to think about leadership and to think about the health of our populations and be in Las Vegas. Because you have on one, right? So the health of our population. So we went to a nightclub last night that was on the 64th floor of the Mandalay Bay. And it's opulent, right? It's beautiful. There's people who have bottle service, and there are people getting served, and they're all decked out and they're fancy. They probably don't have a lot of health disparity unless, they lose all their money the next time around, right? And so they can't pay for that. But I mean, the folks that we saw in that club probably don't have any health disparity, probably do a pretty good job, They're sitting up there having a fun time up at the Mix Dance Club. And then you walk down the Strip. And you might see a little bit of that opulence. So you see the limos going by and the bachelorette parties and the birthdays. But you also see a fair amount of folks panhandling, selling water. My favorite signs are I'm not gonna lie, I just need a beer. But that's how they're making their living. Or so we think, right? We're not sure. We're not sure if that's how they're making their living. They're dressed up in costumes. We saw one lady, couldn't quite tell what was going on with her, clearly had some issues, and I started to think about what is that for her? How would she access health care if she had something? It looked like maybe she was a double amputee and sitting on the ground with her accordion singing for the crowd. But what does that mean for her? How would she access health care? And how are we making decisions about that population to get that health care? And so I think that's a leadership. Deb Toney talked a little bit about getting a seat at the board, making decisions. Jen referenced that we're making the decisions for the people that we take care of because we're the closest to them. We're going to give a voice to all of those. So whether it's the folks on the Strip or in the fancy nightclub. Wrong way. So, some of this is about board service. So this is our next question. So how many of you serve on a local, state, or national board of directors? So again, this is like the education question. Text the number if you serve on one of those boards. Is it working? Okay. Because one of the things as part of the campaign is to identify what our gap is. So we don't know, because we don't ask, how many folks serve on a board. So we did that. In January, February of last year, we sent out a survey to the NONL and the NNA membership to get an idea of board service, how many nurses are serving on boards. And I'll get to that data in a little bit. And whether it's healthcare or not healthcare, I mean, certainly we're looking at it from the healthcare perspective. So quite a few folks in the room. All right, so the leadership recommendation is about preparing and enabling nurses to lead the change to advance health. So that's nurses taking responsibility for their own personal and professional growth. So whether it's attending a conference or a leadership summit to get some education or going back to school, or developing your leadership skills through mentorship programs. It's really about preparing for the future and how we're going to advance care. Nursing associations do a great job of bringing some of that education to the forefront. So, good example here, NONL and NNA teaming up to bring the leadership information to our teams. We need to continue to do that, and that's the role of nursing associations. We need to make sure that our nursing education partners are integrating both the theory related to nursing, but also for our business skills. Because it's changing. Healthcare is changing as we talk about affordable care and moving things forward. It's not the same, what did you say you graduated from nursing school 15 years? As when I finished 17 years ago, or many of you maybe who was longer. It's different. And it wasn't a slant. But it's different now, and we need to be bringing that other piece in. Core measures, how we get paid, all of the different ways that we're getting paid. We need to be talking about that at the education level when people are first getting their education. We need to lead by example. So we're the healthcare decision makers, need to be on those governing boards. So Jeff alluded a little bit to this already, but it's modeling the way. So you can't be a director in our facility if you're not working on your master's or you already have a master's. Can't be a manager if you don't have a bachelor's. Everyone who's eligible to sit for their specialty certification needs to have that. We need to be the examples for our teams so that they know it's okay, or that it's an expectation. And these are difficult conversations. When you first start having these conversations and you say to somebody, you need to go back to school or you're not going to have your job. You know, they're like, well, but I perform at the highest level. I meet all my outcomes. Well, it's an expectation. And so I think, and as I look in the room, I can picture a couple of people. So Laurel, I'm going to call you out over here. Laurel wrote me a story recently about our Pathway to Excellence designation. She's in her RN to BSN program. She's going to finish. And she's inspired several people in her department to go back to school. Derek, and I didn't see Alma. Derek and Alma are two of our nurse managers that are working on their DNP through the UNR-UNLV collaborative. So at the manager level, they're going back to school to get their doctorates. So that's pretty awesome. But that's about setting the example. It's the tone. It's not a conversation of, yeah, you can do that later. It's, you need to do that now. So it's all about that, setting the example and leading the way. So in terms of that, what has everybody else done for that, getting your education and leading the way from that leadership perspective? Audience participation. Yeah, Carolyn.
I don't want to be the only one who's talking. I know others of you have done things. So at UNLV, you see, we do support our faculty to go back and get their doctorate degrees. A little less than half of our faculty are master's prepared, so they get some tuition assistance for their DNP and or their PhD. I personally am honored to serve on the board of the Valley Health System governing board, and so I took the course that Sigma Theta Top offers on board leadership.
Nice. Others? Yes, Susan.
At the St. Rose Community Hospitals, all of our nursing managers, directors, and clinical educators are required to have a master's degree. And we do offer $5,200 a year tuition reimbursement to hospital.
Anyone else? Margaret?
Well, I think it's important for CNOs to have a PhD or a DNP, especially DNP because we have to translate the evidence into practice. So I try to lead that by example in my facility, but I have recently begun preferentially hiring managers and directors at least the master's level. All my new ones have master's degrees. Right, Rachel?
And I think that's a hard conversation. We just did our succession planning meeting on Friday, and as we were looking at maybe potential supervisor candidates, and people would say, oh yeah, she's great, she would be a great leader. The next question is, does she have a bachelor's? If not, get her in school. Or him. You know, get them back in school, because that is going to be an expectation. It is an expectation. All right, so the goals of the leadership recommendation, and this just boils it down into, you know, your 3 quick bullet points. Influence the wellness for our patients and our communities, improve health outcomes for all Nevadans, and increase collaboration across the state. So this is a great conference and a great event for that, because we have people from all over the state in the same room who can have that conversation. You know, and I talked a little bit about walking down the strip in Las Vegas and influencing wellness, but so I did some statistics as well. So we have a lot of opportunity in this state to increase our outcomes or to improve the health of our population. So Nevada is the 34th in suicide rates per capita. We're number 1 in teen pregnancy. High alcohol use, high incidence of diabetes, and several others. So I heard somebody talk about COPD and those types of things. Trauma might be a problem as well. So the good news is, though, is that we're not so high in meth labs, gonorrhea, syphilis, chlamydia, or HIV. So those we've got covered. It's the other side, right? But what it speaks to is that Nevada has opportunity for health outcomes, and it's really looking at the population health, not just looking at your individual patients. So organizations like the Nevada Action Coalition, Nevada Nurses Association, NONL, Nevada Organization of Nurse Leaders, and Nevada Association for Nursing Excellence can really increase that collaboration across the state to attack some of these issues as a cohort or as a group. So about this time last year, Deb Collins and Marcia Turner and I attended a leadership summit in Seattle that was put on by the Robert Wood Johnson Foundation and AARP for the Future of Nursing campaign. And it was really all around this leadership recommendation. And they talked a lot about get people on boards. Get them on the boards, you know. Get them sitting at the table so they can make the decisions. And I remember Marcia, and I see her sitting in the back, saying, I don't get it. Like, why would you just need them on a board? But really, it's about the nurse's perspective from taking care of patients that brings a different perspective to board leadership and decision making. So these were their 3 things to focus on. Number 1, step up and lead. 2, get in a room. And 3, provide support and leverage for board service. So that step up and lead is what I talked a little bit about. We don't really know where our gap is. We don't know how many people are sitting on boards. We don't know what nurses are doing in terms of decision making for our populations. So like I said, we did that survey, and I'll show the results in a little bit. But provide training. It's important that we provide training on what it means to serve on a board. Part of today is about that. And then really connect with our national groups to help us determine where there's needs. Because at Renown, we have a nurse who sits on our board, at the health board, who doesn't live in Nevada. She's from Arizona at Mayo Clinic. So there might be opportunities across state lines as well for nurses to be on other boards. And then certainly to network with nurses who are willing to serve and to identify some of those key stakeholders. The second one is get in a room and get a seat at the table. And this is really about having a plan. So what are our numbers? How many people do we want to have on a board? Is 5 enough? Do we need 50? But we need to identify that as a state. And then a timeline. Is it going to be over the next 12 months or the 24 months? And I reminiscent of something Margaret said earlier today about action steps. You got to put it down. You got to have a plan. You got to put some timelines. So we don't do it. We're like, oh yeah, that's a really good idea. But I got to prepare for this, or the Joint Commissions is going to be at our doorstep next week, or whatever it is. There's always something that gets in the way of that. So we need to put a plan together. And then provide support and leverage board service. So providing education, doing an annual conference, developing strategies to network as a team, and connect nurse leaders in a catchment area, so across the state, which again is this is a good event for that. All right, another poll question. So, if you serve on a board, what board, oh that's weird, do you serve on? So for some of us in this room, it might be NONL or NAC. Is it working? Yeah, it's working. Those are the answers we would expect since those are the people in the room. Which GWIB? Great Basin? No? Perfect. Oh good, so quite a few. So I think this statement from the Future of Nursing report really kind of sums it up. Strong leadership is required to realize the vision of a transformed healthcare system. And this isn't leadership in the sense of a group of employees or processes. It's really about influencing decisions at the highest form. And I wrote a couple of other adjectives down because when I think about this, I think it's, it's that influence, it's the vision, it's the motivating. This is extra. We do this extra. This isn't our paid position. So you've got to have passion around what you're doing to move these recommendations forward, because then it's much more meaningful. It's not a slideshow. It's about how you are. It's about your, if you will, at the core of who you are to advance nursing. And I think many of us have done a really good job with that. Certainly, I've been in the state for a long time, and I've seen a change in that motivation to make things different. So we need to promote nursing leaders, And again, this is that unique perspective. So we talked a little bit about nurses being the closest to the patient and influencing outcomes, and yet only 6% of hospital board positions are represented by nurses, contrasting to 20% by physicians. So we have more physicians on hospital boards than we do nurses. We probably need to change that. Again, not that we need to get rid of physicians. They certainly have their place. That's the interprofessional collaboration piece, but that we need to have that equal footing and to help with those decisions. So here's some other thoughts related to what it shows, leadership evidence, that nurse-led initiatives reduce harm, reduce falls with harm, code blue calls, 30-day readmissions, and improve care transitions. So in 2010, a Gallup poll of 1,500 healthcare opinion leaders said they wanted nurses to have more influence in a variety of ways, especially in reducing medication errors and any kind of medical errors. So that's where nurses make the biggest impact. And so A&E supports a program called TCAB, Transforming Care at the Bedside. At Renown, we have transformational healthcare, which uses lean principles, and it's really, they're about the same, which is that you take a process that's broken, you identify all of the potential barriers or areas that you need to improve, and then you fix them, preferably quickly and in the moment. So it's about, that's how we're going to transform. That's all nursing. I mean, that's what we do. We identify that there's a problem, and we fix it, and so that it doesn't reach that patient. And hopefully we're identifying them proactively, so that we have near misses, or now we're calling them good catches, so that we identify before it ever reaches that patient that we might have a problem. Recently we had a nurse who identified, she went to pull Reglan out of the Med-Select and got Pitocin instead. They look the same, very similar look-alike. It was an emergency. So normally they wouldn't do barcode med administration because they were in an emergency, but she did, and identified right away with barcode med administration that it wasn't the right drug. And so that error never reached that patient, which could potentially have, significant impact to that patient. So those are the types of things that we need to continue to look at for nursing to address in terms of reducing medication errors. And nurses are the closest to the patient to be able to do that. So again, this is another infographic related to the Future of Nursing campaign. Jen talked a lot about what we did with APRNs. We have a 95% NCLEX pass rate in the state of Nevada, which is awesome. You can see our pie chart here of the different nursing programs and graduates from 2012 to 2013. Okay, so the leadership survey. So on your agenda, we would be taking a break now. However, due to a few technical opportunities, I'm going to go ahead and go through the leadership survey. We'll take a break after I finish with the survey results, and then we'll come back at the same time and listen to Ms. Joey talk about board competencies. So we sent out a Survey Monkey in February of this year to identify if people were sitting on boards, what kind of boards they were sitting on, and what help they might need with board service. So we sent out about 400 surveys. I got about 93 back. And this shows that for the most part, no, we don't have, out of that population, not many people are sitting on boards. Of the yeses, so that's the little cones, green is national boards, state boards is red, and local boards are blue. So for the majority of the people that responded, the majority were no, but of those that did respond yes, for the most part, they're staying in their local areas in terms of board service. This shows what types of boards our folks are sitting on. So some of you may be in this room. Local boards, a lot of nonprofit, non-health, that was the majority. Some public health, some public non-health. At the state board level, it's nonprofit, non-health related. And then at the national board, it's a not-for-profit health. I think that was 1 or 2 people. So this is our baseline data, and certainly from here would be the jumping off point that we would want to get more involvement. So this is what we asked the question of, what type of support do you need? If you wanted to serve on a board, what type of support what would that look like? So for the most part, it's even identifying a board. I don't think many of us know that there's health boards out there that need nurses to sit on them to help with that decision making. So identifying the board itself, understanding what you have to offer. What do you bring to that table? What's your unique experience that makes you qualified to sit on a board of directors and help make decisions for a community or an organization? Training. Everybody needs a little training. Again, today is our first step towards that. And then a mentor. Somebody to help you through that process of sitting on a board and what that means. So, that's the survey results. So what do we need? We need your support. That's why you all are here, is to help us to make sure that we can continue to move forward the Future of Nursing campaign. So being involved in action coalitions, talking to us about what you need in terms of whether it's education or support to be able to move those forward, the recommendations that we showed. If you want to know more, this is the Campaign for Action site. So these are our campaign resources. You could type in Future of Nursing Campaign for Action. There are many people in this room who are intimately involved. Deb Tony had us all stand up, so we can certainly help from that perspective to help if you have questions related to the campaign. So Nevada Action Coalition specifically, the future of nursing. So action coalitions are the driving force of this campaign. That's where the work is getting done, mostly volunteer basis. But it's really about having that passion for moving those recommendations forward, because it's going to make a difference. We know it's going to make a difference. If we're able to satisfy all of those recommendations within the report, even in 5 years, it's going to make a huge impact to the people in the state of Nevada and across the country. They're grassroots, they're strong, and we get together a lot and we talk about what we're going to need and who we can tap into for help in different areas. So this is just our org chart. So you can see we're small. Our executive committee, the chair is Dr. Deb Tony. We also have a state implementation grant and program, and Linda Pollock had stood up before. She's our SIP grant person. We have an advisory board, and then we have some different committees. So you heard Jen talk about us as being the co-chairs of the leadership recommendation. For each of the recommendations, there's a nursing lead and a non-nursing lead that's going to help move that forward. Because it isn't just about nursing. So the Nevada Action Coalition and the Future of Nursing campaign is really about population health. And we have partners that are not on the nursing side that are going to hopefully help us, and we can probably help them with some things too to move this forward. So it feels a little nurse-centric when we're talking about it, because we're nurses. We like to talk about ourselves. But it really is about connecting across the state with other partners that can help to advance these. So the SIP grant, which is a state implementation grant, we obtained that last November. And so it gave us some money to be able to do a few things related to the Future of Nursing campaign. And so we have benchmarks that we need to go through and make sure we meet in order to satisfy that grant and hopefully get more grants. So one of them on the leadership recommendation was that we had to have a leadership summit. Welcome to the Leadership Summit. And that's why we are talking about this. So we have several other things. We need to report on our residency programs and are talking about our nurse residency programs for all new graduate nurses, and to increase that baccalaureate number 2020, 80% by 2020. All right, I think this is our last poll question. So based on the Future of Nursing recommendations, which recommendation are you going to focus on in your organization? At Renown, we're very focused on our BSN rates, increasing doctorate numbers, leadership. Those are the things that we've really been focused on at Renown. Leadership, excellent. Oh, it's a slow one. Shoot. So what are other people, are any of the other recommendations folks working on? So we talked a lot about education and leadership, but there's also the interprofessional collaboration recommendation. Is anybody doing anything exciting? Dr. Ashala?
Well, at UNR, we have an interprofessional task force, which was School of Medicine and are doing a great deal with medicine, social work, and community health sciences for professional education.
Great, thank you. Anybody else? No? Okay. We're currently talking about simulation and doing some simulation at Renown with our new graduate nurses as well as some of the medical students. And I know the folks from UNR have been really helpful in getting us to be able to have that conversation and work on that. There's definitely some opportunities with communication and SBAR and those types of things, and I think we can get there with simulation. Another infographic. All right, so here are your folks that you can reach out to if you have additional questions. What questions do you have for either Jen or I or anybody on Nevada Action Coalition? Jeff.
Chris, what do you think the role of the 2-year prepared nurse will look like in 10 years of the center? Will it still be around, or will it go the way of some of the previous roles, such as LPN physicians?
So I think it's how we drive that market, right? You know, if it's preferential hire, then yeah, they're going to end up in maybe subacute areas or in physicians' offices. I think it's going to depend on what the market is going to bear and how we're going to hire. If we make it so that you can't work in an acute care facility without a bachelor's, then they're going to find another place. Because certainly we have a lot of associate degree programs in the state of Nevada, and there's absolute value in that, but I think it's going to be driven out of the hospitals. So I have a friend who works at Washington Center Hospital in Washington, D.C., and he hires about 250 new grads a year. And I said, so how are you doing that? Are you hiring bachelors? He's like, oh, I don't even look at a resume if they don't have a bachelor's. Now, he has 7 bachelor's programs in his general area, so he has that luxury. But he said if a resume comes across that it's associate's degree, it goes in the round file. So I think it's the market. And in Nevada, we don't have as many bachelor's programs, so I think that'll probably prove to drive that. I'll throw it out to everybody else. What are your thoughts?
I just kind of like to mention in response to Jen, not so much acute care hospitals. And let me just say, when you said doctor's office, I'm in the community health center, and I'm looking for bachelor's and master's prepared nurses too.
Mm-hmm.
So there's going to be a problem there.
But I think that's a good perspective.
But what I would like to say is because when we think about the number of nurses that are in Nevada that are prepared at the ADN level, and then I know Carolyn and Patsy have been engaged in these conversations, how do you get to 2-year programs pulled together and mashed together where there are bridges and some of those type of things and perhaps more conversation? I mean, you know, nurses, we always do it for ourselves. We know the pharmacists, everybody's got our PharmD now. You know, so how do we come together more that way? And then just hearing, it's exciting to hear some of the things that are happening in the facilities that are encouraging people to go back. But you can't throw the baby out with the water or however that goes, because when you're hiring nurses, you know, it's very difficult to find nurses that just have a baccalaureate degree. So, like you say, it takes the whole village here to think about what are those things. I have a small nursing staff, and I start thinking, well, maybe it's, you know, when you think about mentorship and that type of thing, my nurses started out with AD degrees, but I can guarantee you every one of them is working on a bridge. Some of them have finished their master's and going back for their advanced practice and that type of thing. So it all comes back to what we're here for today is the leadership.
It really starts, at the top.
Well, Deborah, in answer to your question, we have the first RN to BSN program in the state, totally online. We have in the past year doubled enrollment in that program, as well as doubled enrollment, not doubled, but increased by a quarter our entry into our entry level BSN program. We're a university program. We also need to look at into the graduate education. So not only do we have maybe a program that is right now collaborative with UNLV, but we've been working with our clinical partners and with the state of Nevada to increase the number of tracks and programs that we have to meet our state's needs. One of them being this fall we implemented an acute care nurse practitioner program, which came as a direct community need from Renown Health. And we kind of get into the interprofessional education with that because, not only are we preparing those acute care nurse practitioners in acute care practitioner nursing, but, we're partnering with Renown for pharmacy, for our advanced pharmacy course for those advanced practice nurses. They're working with hospitalists at Renown as well as the acute care nurse practitioners. And fall, we just received approval to start a psychiatric practitioner program. So, I think in answer to your question, what we have to do is partner with our community and our state to understand what is it we need. We don't want to be having programs that aren't going to meet the needs of our state and our patient care needs here. We also work very closely with our community colleges, so we have a smooth transition. We don't require students coming into our RN-to-BSN program to retake pathophysiology, to retake physical assessment. The Nevada system of higher education wants to see everyone, to get that award increase, to graduate with only 120 credits. And we have been working very hard to see how we can consolidate some things. We have just decreased by about, I think, 3 or 6 credits, I can't remember which, the credit hour load for our RN-to-BSN program. So, that's how we are trying to meet those needs that we just brought up.
Thanks, Dr. Ursula. Yeah, hi.
So at Nevada State College, we are moving in several different directions, not only with our RN-to-BSN program, but our pre-licensure program, as we're actually going to call the pre-licensure program to expand spaces to up to 48 in full-time and 48 in part-time for a total of 96 entries per semester. In the RN-to-BSN program, we are having right around 500 students in that program right now. And we've been quite successful in stripping away the barriers that we know that the working nurse is experiencing. So we've reached out to our clinical partners, trying to build clinical preferred partnerships with DEU-like models that are based in the mission of our school, which is care and sciences. And we're having a lot of interest in that. And I think thirdly, to answer the call for moving beyond the baccalaureate level, we're in initial discussions with UNLV on a collaborative program for the entry RN and MSN program. And some of the nursing leaders at the clinical side have expressed great interest in that, and we hope to have more information on that. So a lot of exciting things going on in that college.
Great,
Can I
thank
ask
you.
you a question? Of those 500, how many are from Nevada?
About 85% of those. So we only have presence in about 5 states, which we're starting with the state authorization.
All right. Well, I got a hand in the back.
Chris, I just have another comment with regard to that, because it's about balance as well. And you can't, if you're going to hire baccalaureate care nurses, they new grads or they people with experience, because you can't hire a bunch of grads and have a good balance of, nurses in the business profession for a while, and then new grads that come into the program too. So, I think people can supply
Great, thanks. All right, so it's break time.